A weak chin is actually a really common concern, although often patients might present to the clinic for the first time not realising that the weak chin is the thing that's bothering them. They might focus on their lips or their nose, for example. Now, most commonly a weak chin is just genetic. We're just born with it. Usually a weak chin is associated with an overbite and an overjet. So actually what most people call an overbite is actually really called an overjet, and that's where I've got a slight one where your top teeth come over your bottom teeth. And this is a really common association with having a weaker chin. The chin does also shrink with aging. So although you won't go from having had a strong chin to having had a weak chin as you age, your chin can become weaker. And that's to do with bone resorption and a change in the shape of the jawbone, the mandible, as we age. And that can lead to the chin becoming shorter and squarer, and also to do with more submental laxity, so more of an appearance of a double chin. But truly a micrognathia or a retruded chin is a more genetic association. And actually there are also some genetic conditions, like a condition called Pierre-Robin syndrome, which are associated with this very, very weak chin. If you have one, what can you do about it? Non-surgically, the most common treatment we use is facial fillers. So we'll usually use facial fillers to emulate bone so that we can kind of sculpt and strengthen a jawline. There will be a ceiling to how much we can achieve, and sometimes we might combine it with other treatments, like for example reducing the submental fat pad so that we can refine the jawline a little bit further. There are also excellent surgical treatment options, but these can be quite invasive. So orthognathic surgery is a procedure done by maxillofacial surgeons, which involves advancement of the jawbone so that you have a more prominent chin, and some people may also be suitable for the insertion of a chin implant. Not everyone is appropriate for these, and you really do need assessment by an expert and be prepared to go through a relatively major surgical procedure. If you're going to go down the route of non-surgical treatment, the chin and its importance is something to be considered. And as I said at the start of the video, it's quite common that people who come into me who feel that their nose isn't quite proportionate to their face actually have a weaker chin, or they feel like they want to address their lips because their lips are out of balance. And again, often that can to some extent be coming from the chin. So it's an area we will treat very commonly and is very important in facial harmony and balancing. So be prepared that when you come to see a facial aesthetic expert, the chin is one of those areas we will look quite carefully at. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.